Okay, I'd like to call the meeting of the Social Services Committee to order. Council, can you please call the roll?
Sure, Mr. Chairman. Fine.
Here.
Simpson, Smith, and Chapman are excused. Rosano.
Here.
Cleary.
Here.
Flockhart.
Here, I'm sorry.
McLaughlin.
Here.
And Curley.
Here.
You have a quorum.
Thank you. Okay, first order of business is approving the previous meeting minutes. Do we have a motion? Motion, second. All in favor?
Aye.
Opposed? Passed unanimous. Now into current business.
Item 2 is amending the 2023 Department for Children, Youth, and Families budget for increased funding for secure detention placements. Commissioner Manning is here this evening.
Good afternoon, everyone, or early evening. Yes, we'd like to actually transfer money to the secure detention line, and that is really due to the increase in raise the age children. The secure detention facility has been full for many months, and there is a shortage of raise the age beds for secure detention throughout New York State. So we are about $500,000 short in the line because it's been at full capacity.
Thank you, Commissioner. Are there any questions? Do we have a motion to approve? Motion, second. Second, all in favor?
Aye.
Opposed? Passed unanimous.
Item 3 is authorizing agreements with various Albany County municipalities for the provision of youth bureau services.
Thank you. Yes, we want to continue to contract with 12 municipalities. They actually have youth development as well as runaway and homeless youth. And we've also unfortunately been seeing an increase in numbers of children that are using shelters in situations where they run away. So we think putting it on the front end of youth development, we hope that we can really empower these youth.
Thank you. Do we have any questions? Motion? Second? All in favor?
Aye.
Opposed? Passed unanimous.
Item 4 is authorizing an agreement with the Research Foundation for the State University of New York regarding the New York State Supervision and Treatment Services for Juveniles program.
Thank you. Yes, the STSJP plan is something that we submit to OCFS, and we're really looking at juveniles staying in the community and providing them support so they don't get further penetrating into the family court system. SUNY Albany is conducting research not only with our department, but also is working with the probation department. And currently they're drilling down to really see the root causes of children getting involved in the juvenile justice system so we can intervene earlier and prevent the placement in such facilities.
Thank you. Ms. Lockhart?
Is this study, have they done this before for us?
They have been throughout to see what the trends and changes are throughout the course of the STSJP plan. It's part of OCFS really wanting us to be looking and tracking the data so we can make changes in our services. And I think some things that we've done, MST, multisystemic therapy, is really effective in dealing with juveniles who have significant issues.
I thought it was familiar.
Yes.
To follow up on that, could you send us data or information from the previous studies?
Sure.
Thank you. Ms. McLaughlin?
I guess this air conditioner is making me cough, but I guess that's my question is regards to what kind of results have you gotten in the past? And Mr. Fine has asked for a report. I'm going to see what they said in the past. And are you seeing anything different?
I think we're instituting more evidence-based practices. So therefore, there has been research in looking at, for example, the MST. There's also FFT. We're also, the LaSalle operates an early evening reporting center, which all are things that have helped these juveniles remain in the community and not go into such a secure placement.
Thank you.
Thank you. So is this studying young people who were both in secure detention and through a probation, go through the family court system?
Yes.
It's studying all of them?
Yes, and that's what they're currently drilling the data from probation. So it is very cumbersome and time-consuming because our systems don't, electronic records don't talk to one another. So it's almost like you have to look at a child singly and then track them throughout the system.
And is it looking at outcomes?
Yes, we want to, improve our outcomes so juveniles aren't in secure detention, non-secure detention, and ultimately don't wind up incarcerated.
So it's looking at like whether or not they
Mhm.
are, recidivism, whether or not they go back to
Mhm.
repeating crimes, or if there's strategies to help them. We hear sometimes, obviously we hear a lot about this type of stuff in the news. Sometimes it's criticisms that there's not enough services for them, mental health services, and is this looking at what's available for them and what they're getting access to and what needed?
I don't know really about what they have. I mean, historically, we can, and that's why they have to look at the probation, like what charges did they come in with, and then look at DCYF data of what services were put in place, and then you look, did that child then go further involved in the system? So that would be the recidivism rate.
Okay, thank you. Well, we're looking forward to seeing some of the data. Ms. Lockhart?
Just to follow, in relation to these studies and looking at them, the outcomes and seeing what works and what doesn't work, can you recall any of the programs that maybe you uncovered that they didn't work and you had to change?
We like change. Unfortunately, when we do prevention RFPs, we oftentimes get the same type of service, and they do track their outcomes. I think I've provided information to this committee in the past. And we can always do better. And with the Families First legislation that went into play, we're currently looking at prevention. And the next time the RFP comes out, we need to be selecting from a choice group of evidence-based practice that is put on the Families First dashboard. And then that way we can get also reimbursement from Title IV-E funding.
And that's what I was wondering, Commissioner, was if some of the programs didn't have good outcomes, have we been able to take that money and use it for a program, do away with that one?
Right.
And do it for?
Yes, and we
And
have done that. Yes.
Is there a program that comes to mind? I don't mean to put you on the spot, but.
Actually, Youth Life, we found it wasn't effective. They didn't have staffing. There was a lot of other factors that came into play there. In addition, the ERC we have changed. It used to be for young children through St. Catherine's, the girls through St. Anne's, but we really saw that they weren't meeting the numbers. So therefore, LaSalle was only one granted it, but they do serve both youth and male and female youth.
Thank you.
Thank you. Are there any other questions?
Motion approved.
Motion?
Second.
All in favor?
Aye.
Opposed? That's unanimous. Thank you.
Thank you. Happy Thanksgiving, everyone.
You too.
Item 5 is authorizing an agreement with the Altamont program regarding a Code Blue Warming Center. Commissioner McClave is here this evening.
Good evening. We're requesting permission to provide one-time startup funding for the Altamont program to establish a warming center to assist us in meeting our requirements regarding sheltering people during Code Blue. This will be for $150,000, and it will be up to 25 individuals. This is not a residential shelter. This is just, we'll have seating, minimal snacks and food, and just a safe place and security, just a safe place for people to go who aren't doing well in other shelter systems or can't function in other shelter systems, and need ability to come and go and whatever else their issues might be, but just so that there's a place for them to get out of the cold. That's kind of the function of this. And this is just operating during the Code Blue season. It's not a year-round service.
Ms. McLaughlin?
Is this, I guess I'm trying to where is this building? I know it says 45 South Ferry. Is this a building that's closed right now?
It's been half closed. I think it's functioning, there's a couple of rooms that are functioning as SRO right now.
Okay.
It's been for a while, I think, operating as an SRO, and they've had fewer and fewer people in the building over years because I guess it hasn't worked out for some reason.
Okay. I'm just visualizing two buildings down on South Ferry. Just trying to make
Yeah,
sure.
it's in that Green Street, near Green Street, I
Yeah.
guess.
Is it across from the Salvation Army?
I don't know if it's exactly there.
Okay,
Yeah.
I know what you're talking about. And it just looks like it's closed up.
Kind of, yeah.
Was this a shelter in the past, though, this building?
No, it was not a homeless shelter. It's been an SRO, and I think it
Okay.
was, I don't know, it was possibly a substance abuse facility at
Yeah.
some point.
Okay, yeah, I
Yeah.
thought it had some sort of service, yeah. Okay.
Make a
So,
motion to
are-
approve.
What, I have a
Oh,
couple
sorry.
questions. So are people, they're not sleeping there, they're just,
It will be, we'll probably have some lounge chairs, so
So-
you will not have beds.
but
This
people
is-
might spend the night there to stay warm, but they'll be in like a lounge chair and
Yeah.
share.
Yeah,
There'll be bathrooms and,
snacks and hot and cold drinks and a place to shower, but it's more of a drop-in center for the nighttime as opposed to an actual shelter.
okay. I just, my concern is that I know that people in the neighborhood bring up constantly, this is my district, bring up constantly that there's such a large concentration of services there, the city mission's right there, and, we care about, I think people in the community care a lot about homeless people and care a lot about people who are facing these types of issues, but also want it to be spread out a little bit more, don't want to bear the burden of all of these services there. So, it's a tricky situation. Do you think this is something, I can see some people being concerned with this, is this?
Well, we
it's
hope
gonna bring
it kind
more
of solves the
people
problem.
there, or-
We hope it solves the
Yeah.
problem and that it will pull people inside.
Yeah.
And they will be managed and supervised and there will be security there. But,
It's,
yeah.
I'm sorry.
Ms. McLaughlin?
Mr. Chairman, I'm very sorry.
That's
But I agree with you. I think some of the same people that people are talking about are the very clients that you're gonna have that are be a part of this 25 people. That area, usually if the mission is overcrowded and they don't have room during Code Blue, those individuals are still out there. So I see this as addressing the issue that people are concerned about. I understand we don't want a proliferation of services, because we do our fair share. We do more than our fair share in the South End, but that's where they are. So that's where they are. So I think that this is going to address some of the concerns that people have in regard to individuals being out on the street and loitering and just, in Code Blue, they want to get inside. I mean, it's pretty cold outside, we got a Code Blue going on, and
18 degrees this morning.
yeah, last night would have qualified, I think.
Yeah, I definitely wouldn't want to stop a vital resource like this, just, I think this is something we have to look at
Yeah,
moving
it's a
forward, is where
catch-22.
these types of services are located. But,
Yeah, we didn't, it was a bid and only one response. And we'll see how it goes this season. We're kind of in that mode, see if it works.
yeah,
And,
Well, you gotta put them where the people are.
well, yes, but homeless people also don't have a set location.
I know, but they're not gonna travel up to Colony and Albany and stuff like that.
They might if it's on a bus line.
there's homeless in Colony.
Yeah, there's homeless people everywhere. I think it's a regional problem, but this also isn't a shelter, and I'm hopeful that it may solve some of the problems as well. So
It's another
it's
option.
definitely needed, so. Are there any other questions? So we have a motion to approve. Motion. Second. All in favor?
Aye.
Opposed? Passed unanimous.
Thank you.
Okay, motion, thank you, Commissioner. Do we have a motion to adjourn?
Motion.
All in favor?
Aye.
Opposed? Meeting is
What
adjourned.
time is this, public hearing? 7:15?
Now we're